Hi, this is Caroline Hamilton, and I'm going to be your presenter today. And I also want to shout out to Athena Security and thank them for sponsoring this webinar today. And I've been working with them very closely to try some new methods to reduce workplace violence in healthcare. And one of the things that make me angry that I see over and over again are people doing incremental small things. And this is not an incremental small thing. This is a big scary thing, having people shot and hurt in healthcare environments. So we're going to go through that and look at some of the threat data that supports what I'm saying, and then also looking at some different elements too. So here we go. So this is my background. It started as a risk assessment expert doing risk assessments all over the world for hospitals, for academic medical centers, for behavioral health, for coalitions and federal government, federal agencies, and just everything you can think of. And I've actually written risk assessment programs for many hospitals, including one that's designed to prevent medication errors in pediatric patients with the Department of Homeland Security, and also CHOP, which is Philadelphia Children's Hospital. We work all the time with this and try to make people more aware. So these are some of the things that happened lately. This was a gunman armed with a rifle and multiple magazines of ammo, killed 3 people, injured 2 in a shopping mall before he was shot and killed by a 22-year-old. This is a nurse and paramedic who were stabbed and left with serious injuries. They both survived, luckily, at SSM Health, DePaul Hospital in St. Louis. And the nurses said that the hospital leaders and what's so amazing about this is they actually came out and said, we have been to these hospital leaders over and over. We have begged them to increase security. We want to have armed security at the hospital. We want a bigger security staff. And also we want to add concealed weapon detection to the weapon screening because they were having so many incidents involving guns and knives. And that's one thing I noticed, is that no matter how you put it together, what happens is people get cuts all the time, real serious, very serious ones, kill people with knives, use guns and kill people too, and they're all free in your hospital and your healthcare organization. There are so many guns that when the Cleveland Clinic do a pilot with weapons screening in northern Ohio hospitals, that what happened was they found 30,000 weapons that came into the organization in a 1-month period. And those were all going in already. And that was 3 hospitals in Northern Ohio. And there was the CEO who wrote about this in an article for Forbes magazine and said, basically, if you're not screening for weapons, you're not doing your hospital staff, you're not treating them fairly. And in this case, what happened and how they found out about this was because this 30-year-old lady, Jamissa Rivers, was arrested while she was trying to kill staff members. She came in the hospital, she had a knife in her purse, and the nurse looked up. She was stabbed in the neck and the back. Another nurse heard somebody say she has a knife, and she looked up and she saw this lady just stabbing everybody who was in reach of her. So all the paramedics ran in. They managed to subdue her and stop her. And of course, they said, again, we have asked hospital administrators to add more security guards, metal detectors, and they said they weren't even surprised when they heard about the stabbing. They said it was 100% preventable, and that they'd warned them over and over again, said one nurse who no longer works for the hospital. And actually turned out that the nurse went to another hospital that I work with and called me up and told me this was all true. And they'd gone up to an area that was half the way across the country because they just couldn't stay at DePaul. They said, when you're working at DePaul, you're walking down the hall looking over your shoulders. And so they recovered the knife, and the prosecutor said it's unthinkable and unconscionable to attempt to take the life of medical professionals on duty trying to save lives. The prosecuting attorney in St. Louis said she was taken into custody, the lady who did this, charged with 2 counts of first-degree assault and 2 counts of armed criminal action, and they set her bond at $2 million. So that's what happened. And then this happened. This is the very next week. DePaul comes out. This was in the middle of July. DePaul Hospital comes out in Bridgeton, which is a suburb of St. Louis, has increased security in its emergency department 1 week after a nurse and paramedic were stabbed by a 30-year-old. And of course, for years, the nurses have been going in and asked. And finally, 1 week after the event, they say that it's something that they were going to do anyway. The statement that the management person made, the spokesman, said that they had already hired a security guard to be in the emergency room 24/7. They had added a metal detector, and it's the 6th hospital in St. Louis area to add a metal detector to the emergency department. Because if you don't have a metal detector in your emergency department, you have guns and knives in your emergency department every single day. You're just not aware of it yet. Perkins said that they'd spent several months conducting a system-wide evaluation of their physical environments, seeking input from team members. It wasn't that. It was because they had such a high-level, high-profile event that happened. And as a result, they said they're going to make more improvements to the entire system, which is a good thing. Everybody else is tracking this also. Active shooter is the number one thing that keeps administrators up at night. And this is just a little review of the active shooter incidents in the United States in 2021. It was the last year that they measured. You can see here that this report came out in May 2020, May 2022, and the next one will come out May 2023, and we'll see. But basically, this violence, especially in healthcare, is going up every single year and in the whole country. So this one report I'm showing you now, again, it's an FBI report. It's not exclusively healthcare. It's everything, and it's for the whole country. And it shows you the instant difference between 2020 and 2021. And one of the VPs of another large hospital in the Northeast saw this same presentation, and he's sort of a friend of mine. So I asked him, I said, John, what did you think about the webinar? And he went, oh, I thought it was great. And I said, what did you really get out of it? He said, what I got out of it was that comparison about how much these events have gone up in the last year. And in healthcare is the worst. It's out of all professions, including working on a high-rise building or being up on a telephone pole. This is the worst, healthcare. So here's what happened in 2020. So in 2020, we had 40 incidents in 19 different states. In 2021, we had 61 incidents in 30 states. 2020, we had 164 casualties with 36 people killed and 126 wounded. Look how it went up in 1 year, from 164 to 243 with 103 killed. So it's 3 times the number of people who were killed from 1 year to the next, casualties, and 140 wounded. And look how much the incidents went up, from 164 in 1 year to 243. And then this is law enforcement killed, 1 in 2020, 2 in 2021. Law enforcement wounded, 11 in 2020, 5 in 2021. The ones that met the definition of an active shooter, mass killing, 5 of the incidents met that in 2020 and 12 in 2021, over more than double. Incidents where law enforcement engaged the shooter, 8 in 2020, 17 in 2021. The shooters, 42 were male in 2020. Well, actually, it's 35 male, 3 female, and 4 unspecified. And in 2021, 61 of the shooters were male, out of 60 out of 61, and only 1 female. The body armor hasn't really caught on with active shooters yet. You see it occasionally, but not much. One wore it in 2020 and 2 in 2021. How many shooters committed suicide? And I went back and did my own research based on all these numbers that I get from the Gun Institute. It showed that what I found was that the shooters who committed suicide were usually over 55 or over 60. And the older they are, the more likely they are to commit suicide and not wait to get arrested. But the younger guys who are 18, 24, and things like that, they surrender actually when they're finally caught by the police, and usually they go to prison. In fact, we just saw that yesterday in the trial of Nicholas Cruz for the Parkland massacre, where 17 children were killed and 17 injured, total of 34 casualties. And they're complaining now because one juror held out. Everybody else wanted to have him put to death, execute him, but one held out. They didn't get a unanimous verdict. So now he's only 24. He's killed all these people, and now he's going to prison for the rest of his life. So how many shooters were killed by law enforcement during the event? 4 in 2020, 14 in 2021. So this is almost 4 times the increase, 4 times, 3.5, whatever. Shooters killed by citizens, like we just saw, 2 in 2020, 4 in 2021. So, and how many were apprehended by law enforcement? Again, it's the younger people, 24 in 2020 and 30 in 2021. So it just shows you that no matter what we're doing, and I have a list of hospitals, I have the control measures for hospitals, or safeguards they call it, and of these controls, they go up every single year. And because all the incidents go up every single year, almost every single hospital, if you look at their incident reports, you will see that they just go up year after year after year. and they never go down, no matter how much you spend on security. And this just shows you that one of the driving factors in this are the lawsuit. And so this was a lawsuit that faulted the security company Securitas for more than $500 million for not pressing an alarm when they found out that there was starting to be a collapse. The guard called 911 about 10 minutes before the collapse, but she didn't press the voice alarm, the in-unit voice alarm that would have gone to every apartment. And so what they're claiming, this was a Surfside condo collapse. We claim she wasn't trained to press the button. How much training, if you're an adult, do you need to press a button? Which if she did, there would have been an ear-splitting shriek in your condo and you would have immediately left. So many lives would have been saved. The security company they're also charging the contractors and other people there, but basically they're suing the security company of almost $1 billion for not pressing that button. So again, I'm sure you already know this, that the workplace violence in healthcare isn't slowing down. It occurs more frequently today than it did in the last decade and the decade before that, and more than it did yesterday. And so we have to have some kind of intervention. We have to do something tangible, not just sit around and wring our hands and say, oh, it's so bad in healthcare, as these people are quitting and they're not coming back. And it's every healthcare hospital meeting I've been to in the last 3 weeks, and I've been to quite a few, everyone says, the most problem we have is we don't have enough staff to do the job. We can't take care of patients. Some people are putting patients in giant rooms, almost like dorm rooms, so that the nurses have an easier time of going to every patient and checking them at the same time without having to go from floor to floor and, one end of the hall to the other. So again, OSHA is the one who says this is more dangerous than working on a high-rise building. And now physicians have been killed, and they're getting involved now. So 7 out of 10 physicians in the American College of Emergency Physicians said that emergency department violence is increasing and it's actually affecting patient care. So why is it turning out this way? It's because security is still an afterthought. People just don't get it. And so they think about everything else first. So they worry about the cafeteria and they worry about this and that and all these other things. They spend a huge amount of money on everything else about the hospital, but security gets the end of it. It's like an afterthought. It's an expense item on the balance sheet. So the last 4 months, last October, November, December, last 3 months of the year, because they try to keep the expense items, or for most hospitals, it's really June. So that'd be like March, April, May, June, 3 months. They say, let's not spend any money because they want their balance sheet to come out looking better. And so every expense item that they put on there tears it down. So that's why you have to go in as soon as the new budget comes out. Usually it's July 1st. As soon as that new budget comes out, you go in and put your request in for the security controls that you need, because you're not going to probably get another chance at that. Also, security is still following this law enforcement model. In fact, about 50% of the people in security used to be in law enforcement. And unfortunately, law enforcement is completely different than security. It's not the same thing. In law enforcement, you something horrible happens and you track down how it happened and who did it, and then you find them. And then you turn them over to the Justice Department or to the local police or to the sheriff or whoever. But that's how it works. Somebody does something wrong, the law enforcement goes in and catches them and then turns them over to the justice system. And security is completely different than that, because in security, you have to, especially in hospitals, you have to follow a hospitality model. You have to be nice to people all the time. You have to scale back the strictness of if you find somebody, who's doing something wrong, you can't just take out your gun and say, lay on the floor with your hand behind your head. You have to finesse it a little bit. You have to go up and say, yes, we need to talk to you privately, come over here in this room with me. And then you could tell them privately, whatever they did and maybe they didn't put their COVID mask on or whatever, or something worse. But anyway, they don't also, I think management doesn't realize, they think physical security, they think of a cop and they think of a gun and they think of forcing people to do things. And it's not that. In fact, most physical security controls are so technical that most hospitals have a technical security officer just for facility controls. And we're talking about the card keys, we're talking about push pads, we're talking about all the electronics, the hospital videos, cameras, the kind of information they collect, the surveillance on the cameras, the monitoring of different areas and things like that. So it's this artificial thing. They say, oh, it's IT or it's facility security. No, it's the same thing now, really, except for network and internet things. it really is the same thing. It's just as technical. We had one of the worst summers for hospitals we've ever seen. These are some of the incidents that I just picked out to share with you. One of them is the Tulsa, Oklahoma shooting. And in this one, 4 people were killed in the Natalie building of the St. Francis Health System at 64th and Yale. It's the big campus, St. Francis campus, a big St. Francis hospital. This was a medical building to the side of it. It had doctors in it. It had X-ray scanners, things like that. Part of the hospital, physically, but it was part of the hospital group, the health group. And so this guy, Michael Lewis, he was brought in and have his back operated on. He walked, the day he got out, he went to the gun store and bought an AR assault rifle, AR-15 style rifle from a local gun store. And he went back to the hospital because they had no security. They had no screening in the lobby for weapons. So he just walked right in the front door, walked right up right into the elevator. The receptionist said, ask him to stop, and he shot and killed her. He went ahead up to the second floor and he targeted the surgeon who had operated on him, Dr. Preston Phillips. It operated on his back. He killed him. And there was another doctor who was there with him, and he killed her and shot and killed her too. And then he also shot a bystander too on his way out. And he bought on the same day he got out of the hospital, he purchased the assault rifle. He took it to the hospital with him along with his 40 caliber Smith & Wesson semi-automatic handgun he'd bought from a local pawn shop. Now, if you'd had weapons screening at this lobby so that they just had to walk in real fast, you would have no problem, because it would have caught those guns and taken them away from him and locked the front door so he couldn't get back out, or automatically called the police, so the police would have been there within 3 minutes, and this whole thing would have been avoided. Instead, 4 families and 2 doctors, the doctors are the ones who got killed. You can't have that going on, and that was just one of the worst ones we've ever seen. What could have prevented this? Could panic alarms that's something people usually don't have, which amazes me all the time. Panic alarms, individual panic alarms that when you pull the cord it makes a loud sound. No, that wouldn't have helped. How about having a receptionist? They had a receptionist. That didn't help. He just killed her. They did the same thing at the Navy Yard shooting years ago. They shot the only guy who had a gun before the guy walked in. Did they have if they'd had an armed officer in the lobby of that medical building, maybe that would have helped. Could a policy help? People in the healthcare field spend a lot of time with new policies. Our industry groups like IAHSS have policies. Other people have policies. The American Medical Association has policies. College of Emergency Physicians have policies, but policies don't stop anybody. Number one, they take time to train and people to learn. Sometimes people ignore them. And of course, if you get shot, that's really limits your ability to follow a policy. So it doesn't make any difference. It doesn't cut down the casualties by having a policy. Faster police response? Nope. Usually happens within 1 minute, 1 or 2 minutes. Police can't, if they get thing saying there's a shooting at this place, or they get a gunshot detection thing, it's already over because they're too far away. They get the notice about the detection. By the time they even if they ran out of the building, as fast as a human could run, went to their car, started it, and drove across however far they had to go on a campus, not very far, still not going to get there in time. The person's already dead. Concealed weapons screening is the only thing I know that actually will stop a bullet and get the weapon out of that person's hands. And again, 30,000 weapons in a month in Cleveland Clinic. That's why when people, and you could call me and request a pilot too if you want. And what happens when they do a pilot, they set up this simple system in your lobby or anywhere else, maybe at the emergency department. And they usually within 2 or 3 hours start getting weapons. They start finding guns and knives with that fast because they've never checked before. And even there's some situations where I remember one in Tennessee where a doctor actually had a heart attack and had to be put in the hospital bed in his own hospital. And he stabbed the nurse because it took her too long to find a vein when she was, looking to take a blood sample from him. He had brought a Bowie knife upstairs to the room in his backpack and put the knife under his pillow. And he took out the knife and stabbed the nurse. So you'd be surprised who has a weapon on them. And sometimes it's even the doctors or the nurses. fact, we had one situation, it's not in here, but it's in Philadelphia, where the emergency room nurse committed suicide. He brought his own gun to work. There was no medical screening, no weapons screening. They just, oh, hi, doc, how you doing? Oh, great, thank you. And he goes up to the emergency department, works half his shift, takes out the gun and kills himself, shoots himself in the head in front of the other doctors, all the people waiting in the emergency room, just absolutely horrific. That wouldn't have happened. That's my gauge, is would this have happened if they had this control in place? If they had a new policy, wouldn't make any difference. But if you're screening for them and you can take the weapons away from these people, it makes a difference between life and death for every single person. This is just another same thing in the summer. These all went, but week by week, actually. So one week had one, next week had one, next week had one, all the way up to August. This is Encino's a suburb of Los Angeles, and this is the Encino Hospital Medical Center. I grew up in LA, so I've been to this hospital before as a child. But the doctor and nurses stabbed at the Encino Hospital Medical Center. In this one, a man just drove up to in front of the hospital. He parked he didn't park his car. He left it in the middle of the street, took his dog with him, who was on a leash, and barricaded himself in the emergency room. On the way in, he had killed a doctor and stabbed a doctor and two nurses. And then they brought the SWAT team, and he tried to negotiate with him. And after he left his car in the middle of the street, he walked into the medical center before 4:00 in the afternoon. 90% of these things in healthcare take place between 9:00 in the morning and 5:00 in the afternoon, regular business hours, I guess, for shooters. And he walked right in with his dog, and he said, I want some anxiety medicine. I feel really bad. And another x-ray tech who was there, ultrasound technician, said that he was all sweaty and his pupils were dilated and he looked really, really anxious. And she said, of course, we can't give you anything. And so he stabbed those people, and the 3 victims were taken to a Dignity Health hospital across town in critical condition. And one of them had to go to surgery. They said the man who did the stabbing had a lengthy criminal record and two arrests in the last year for battery of a police officer and resisting arrest. And again, it was all over. This is in Houston, Texas. So that's happening every single hospital. No part of the country is safe. The lowest one that has incidents is in Maine. They have very few incidents in Maine compared to the rest of the country. So this was a lady that they had sent out the ambulance. They told the ambulance driver had creating a disturbance and threatening people with she had a gun. The ambulance was dispatched to pick her up and bring her back to the hospital, which it did. And they brought her into the hospital strapped to a gurney at Conroy HCA Hospital in Houston. It was Houston suburbs. And she pulled a gun out. Somehow they didn't pat her down when they put her on the gurney. They didn't check what she had in her pocket, and she had a gun in her pocket. So they brought her into the lobby, and she started shooting right away. Luckily, there was an EMS guy there who saved the day by disarming the woman after the first 2 shots, saved the lives of all the people. It was in the emergency room, not the lobby, but she was able to pull a gun out after she'd already been strapped down. So that was, I thought, like a really weird thing. And they commended the guy for acting quickly, and we're aware that there was an incident. But again, at least maybe not metal screening, but at least patting down somebody who you're bringing into the hospital who's under your total control. You got to get in this idea of disarming people who are coming into the hospital, and you have to put the decals on the doors too. All the outside doors have to have a decal saying no weapons. Why do you have to do that? It doesn't stop anybody, really. Somebody who's coming in and sees a sign might turn around and go put the weapon back in their car, in their trunk or something, lock it in their trunk. The reason is about compliance and liability. Guy comes in and he shoots 3 people, and they say, yeah, well, there was no sign in the hospital that said I couldn't have my gun there. The whole argument changes. But if they have to open the door and walk in a door that has that no weapon sign on it, they're basically admitting that they knew that there was a law in place, a requirement for the hospital not to have guns, so that you can always hold them on that charge, right? So that's just something else to think about. But compliance and liability are things that we think about constantly because there's so many, the awards for it are getting so bad. In fact, we'll talk about Uvalde and what's happening there. They just fired the entire security staff, police force there. They had 5 days after all those kids were killed in Uvalde, Texas, some local attorneys got together and they put together a lawsuit, a wrongful death lawsuit for the people who were killed in that, which was 17 kids. And they actually served the summons on the school board during a school board meeting. And they asked for $27 million. $27 billion, to reimburse the families for all the pain and suffering and everything that happened according to that. Same thing and of course there's CMS, which is the Centers for Medicaid and Medicare, and they put up the final rule on emergency preparedness about 4 years ago, and they also require you to do all these things like have no weapon signage, like doing a drill, doing tabletop drill, doing active shooter drills, also, posting certain things and having no possible ligature equipment hanging from the ceiling, all these things that they check every single year. And what can they do if you don't comply with CMS? That's why this is the very worst of the standards. CMS, the most difficult to comply with. They require you to do all these things. And if you don't do them, they can actually take an index card and write on it hospital closed and scotch tape it to the front door and the hospital's closed. They can also deny admissions to people. They can say no new admission, and that they have the right to do that too. They can also fine you, and they can also give you, if you're a hospital administrator or a senior management in that hospital, they can activate the federal exclusion clause. And the federal exclusion clause says that you can never work at any other hospital. You can never receive federal funds at any other hospital you work at, not as an owner, not as a key officer, management person. You're out of healthcare, basically. There's the OSHA general duty clause, and this is about to turn into a real law, federal law. Right now it's a clause or guideline, but it's going to be a law soon. I just read about it last night on my way home on a plane. But it requires every employer, even a school board member, a hospital member, anybody, to maintain a safe environment free of recognized threats. So that's why CMS requires you also to do a threat assessment, and OSHA requires you to do a workplace assessment, work site assessment. And you have to show that you've considered having an active shooter and all the things that you did to reduce that chance of happening. That's why we have to go through the threat analysis that we're going to be talking about. And again, the federal standard is coming called, if you want to look at it today, you can look up OSHA 3148. It's specifically for healthcare and social service workers. This is a guideline document that it was based on. This document was written in 2015 and it never got passed by Congress. This is a guideline for preventing workplace violence, and you can get it. Its official name is OSHA 3148, and you can just look that up on the internet and you can get the whole document. I think it's like 50 pages long. But now the Senate bill was passed in the summer. Tammy Baldwin in Wisconsin introduced it, and it's going to be the Workplace Violence Prevention for Healthcare and Social Service Workers Act. There's also a SAFE Act that's being proposed by somebody else. The House part of this bill passed in April of 2021. And now this summer the Senate bill passed, so they're reconciling those two bills together. How do you prevent this from happening all the time, and what threats do you have to look for? All these requirements, the OSHA and the CMS require an annual security risk assessment. So that's the number one thing that you have to do. Second thing you got to do is have to have access control. There's no doors. All doors have to be able to be locked, and preferably on a card key control. And preferably, so some of them even have reduced egress, or you have to press a button to be able to get out. The next is number 4, having an armed officer in the lobby, securing all your doors. We're talking about this again, and it's come up in the last 3 active shooter incidents we've had, is the back doors propped open. So who has to shoot your way into a building? Who has to worry about a keypad or anything? You just wait for them, the cafeteria staff in the back of the hospital, to leave the doors open at night, and boom, you're good. And which I think is just unconscionable to do that, but that's what's going on. And the other is the enforced concealed weapon screening, and that has to be a requirement, and you have to have it in the lobby, the main lobby, or the head of the opening to the emergency room. And again, if you're interested, you can call me and I can set up a pilot for you. But it's enforced weapon screening. You have to keep the weapons out of the hospitals. Also, the propping. I think you need bigger penalties for door propping open. I worked in a hospital in Los Angeles where I asked them the first morning I was there at 9 o'clock on Monday, 8 o'clock on Monday morning, can I go down to the cafeteria and get some coffee? And they said, oh no, our cafeteria is closed for 2 weeks. Well, why is that? They had a rat infestation. So they actually had rats in the property coming in at night with the doors propped open and smelling the food preparation going on inside. And there were so many rats, they estimated it was going to take 2 weeks to get them cleared out. So these are some other controls that we recommend too. Of course, access control for all doors, having a designated area of refuge. refuge in case a shooter comes in the lobby and people need to hide, a room without windows and with a good locking system on it, bollards, posts, and barriers at front entries to your hospital, and also side entrances, any place where you can just walk off the pavement and see the glass right there and run your car right into it. That's what this is designed to prevent. And it's also lawsuits have happened. I'll tell you about those in a minute. Camera system, all digital. No, not we want to replace all analog cameras with digital cameras. Recording, we want you to track them and monitor them. And have what drives me crazy is if I want to see the camera system for how you're monitoring the cameras, I find them locked in the IT closet and nobody has a key to it. So what good is having a bunch of cameras and screens that are tracking what's going on in the whole hospital if you can't even get to them without a key? And of course, the IT guys always at lunch. So the other is concealed weapons screening, which we've talked about before, having your disaster recovery and your emergency plans, and CMS also tracking and wants to see not only your risk assessment, but then they want to see your emergency plan, and specifically they want to see how you've updated that plan in the last year since you did the last risk assessment. So they want to see exactly what you've changed, who you notified, which new partners you have, all these things they want to see. I've had to go to many hospitals and sit with the emergency management people from CMS and show them how we constructed the plan and what it covered and how it put things together and how it was updated, and also all your policy procedures about emergencies, your incident reports and how you're recording all those. I went to one place where they had an incident. I asked to see the incident reports. They took me to the security break room. What they'd done is taken little pieces of paper, like they cut up pieces of paper, Xerox paper, into little squares. And so at the end of your shift, if you're a security officer, you have to write down the time, the date, what happened on that shift. If anything untoward happened, I folded up double to make this little tiny square, and they had a big giant fishbowl, and you throw that report into the fishbowl. They actually had that system. They had 18 months of incidents in little tiny pieces of paper in the fishbowl. I had to stay 2 extra days to unpack and unwrap all the security reports and put them into a spreadsheet. You don't want to do that. So you want to have a good way to keep your incident report program. And then, of course, intrusion detection systems too, to keep people out of where they're supposed to be. And so what we do is we look and say, okay, how much of this is in place? Is it 100%? Every door is on a keypad now? Or is it 50%? Or is it 2 buildings out of 3? The area of refuge, is it advertised? You have a sign on it saying area of refuge, just like in airports now, they have a tornado station that's in the thing that people can go hide. Again, a windowless area, that you can go hide in, bollards and posts in the front, all this stuff. And then comment, and then how much is it in place in your facility? Maybe it's 100%, maybe it's 50%. How about another facility? Could have 1, 2, 3, 4, 5, how many facilities you want. So again, this is turning into a huge problem in healthcare. It's happening every day. I just wrote an article about it that's coming out in the IAHSS Journal of Healthcare Safety and Security. 95% of nurses now say they don't feel safe from violence at work. And they said, we want people to start doing something about that. You just see it day after day. And they say violence in healthcare settings happens every day on every shift and in all units of the hospital. So again, there were revenue problems that prevent some hospitals from putting in the controls that they need, but they actually have the money. They're just spending it in the wrong places. And people, that's one thing they said in Uvalde, it can't happen here because we're a big community and everybody knows everybody. And older administrators still think of hospitals as places of refuge. And so they won't allow us to put screening in the lobby because they think it makes them look dangerous when actually it makes them look safer. Many aren't aware of the fines, all the fines, the 20 fines that CMS can charge, plus all the OSHA fines, plus the wrongful death lawsuits, as you can see, are getting up to $27 billion, and don't understand that a lot of these elements required by CMS are required. They're not a choice anymore. It's not a guideline anymore. It's actually a law, federal law. So that's why I think that having access control, concealed weapons screening is the best idea. It's the only thing that you can actually count on to keep weapons out of your system. And if you keep the weapons out of your facility, then nobody gets killed, right? You can have people hitting each other in the mouth, but that's not permanent. Dying is permanent. So I'm on a mission to get these weapons out of hospitals. Over 50% of hospitals still do no kind of screening at all. Hi, Mrs. So-and-so, how are you feeling today? Go ahead and take the elevator up to the 5th floor. That's it. And she may have 5 guns in her briefcase. In fact, we had just one where they had a whole weapon full of unlocked weapons in an unlocked closet. I think it was in Orlando. Nobody ever checked. The cleaners opened the closet, saw the guns, didn't say anything about them. And of course, somebody's going to take them out one day and use them. And that's exactly what happened. So again, when you're talking about these threats, you want to go to your management and get money to obliterate them. One of the things you have to do is you have to wait till something terrible happens. Unfortunately, if everything's great and nothing bad's happened, people are very reluctant to put these controls in place. But if you get it the day after, like we had this big incident yesterday in North Carolina, and when they read about that and see how that went, they're going to come back and say, okay, well, what are we doing about weapons screening? And you're going to hopefully say, oh, we have a new weapons control system that we already ordered, or you're going to say we haven't done anything about it. And that's when you have all these casualties happen. So again, you have to show what the return on investment is, how cheap it is to put one of these systems in place, and how many lives you save for that little kind of small investment. You also do not have to have a security officer sitting by the machine all day. So this new configuration that they've invented actually doesn't require a security officer. The machine does everything itself. It finds a weapon, it makes a sound, it alerts everybody at the same time in 1 minute. So it cuts down on having a 7-day-a-week, 24-hour-a-day security officer have to sit there. And again, it's the risk-based assessment methodology that looks at high-value critical assets in a hospital. Those are the patients. It's the equipment, it's the facility itself, and it's currently used by every single federal department, every single emergency management, the Department of Defense, and required at all levels of government, state, local, county, federal, everything. That's the one that everybody uses. And then we can look at how to calculate the return on investment by looking at the initial cost of the control, how likely threat is to occur, and we get that by looking at how often it's happened at other hospitals and in your area. We also have the access to FBI, the Uniform Crime Index. It shows the crime by zip code where you are and how many violent crimes have happened, how many property crimes, everything. And then you calculate the return on investment. So if you do it for something like a concealed weapon detection system, as I've been talking about, it's like 1 in 200,000, because if you spend $1 applying this system, you can save over $200,000 by preventing not only somebody from dying, but preventing these wrongful death lawsuits. So again, the required areas are to submit the all hazards and security and safety risk assessment on every single facility every year. This is a CMS requirement. I really appreciate your time today. If you'd like to contact me, I'm at Caroline at riskandsecuritylllc.com. Athena Security is at www.athena-security.com. And they also have demonstrations and videos right on their website that you can look at, get a demo right online, or we could call us and we'll set one up for you. So I want to thank you tremendously for being here today. And again, I hope you have a great weekend. Bye-bye.